Are you suffering from hip pain? Now, all hip pains are not arthritis. So, there is other problems in the hip. Most of the people who have hip problem either end up being diagnosed as arthritis in the hip or hip sprain. Hip is much more than what has been diagnosed in society. This is a part of a medicine which is called sports medicine of hip, wherein we deal with labral tears, soft tissue tears in around the hip, which can cause problem in young patients. So your hip joint is a ball and socket type of joint, but this joint needs stability. For that we have a tissue surrounding it, and predominantly it is called a hip labrum and all these muscles around the hip. So these also can get injured and cause hip pain. So not only the wear and tear in the hip joint which causes the pain, it is the soft tissues also cause problem in younger patients. So if you have a X-ray with a normal looking X-ray, always question if you have a problem in the soft tissues. Okay. Typically you go to a doctor, they will do the X-ray and they will say there is no arthritis, hip is normal, but still you have a pain. You take medications, not settling down. That is a time you should get a high resolution MRI scan which can help to identify the soft tissue problems. Typically, the scan can show labral tears or a femoroacetabular impingement. The arthritis means there is a wear and tear in the cartilage and the bone is rubbing on the bone. That is called arthritis. Now, arthritis can be because of the age-related arthritis, or it could be because of the blood supply, reduced blood supply to the hip joint. Now, it is called avascular necrosis or AVN. Lot of patients after COVID have had hip problems. So if you had a COVID or you had a fever during the COVID time and suffering from hip problem, you need to get your MRI done to see if there is a avascular necrosis in the hip joint. People who are smokers, who consume excess amount of alcohol, or people who are on steroids for medical conditions, develop a condition where the blood becomes too thick to go into the hip joint. Thus, part of the hip joint dies, leading to avascular means lack of blood supply. Avascular necrosis means dying of the bone. So when the blood is thick, it is not able to reach to the hip joint, leading to death of a bone, which is called avascular necrosis. Because of the body weight, it cannot hold the weight and then starts crumbling like a weak building, leading to collapse of the bone, which leads to the pain. Now it can be in stage 1, 2, 3 or 4. A fourth stage is advanced stage, which usually requires hip replacement. So what is hip replacement? Hip replacement is a surgery where we resurface the damaged part. We are not going to replace the whole hip, it is resurfacing. So that's your thigh bone. We have cut the ball is missing here. Instead of that ball, we put this artificial ball which directly goes into our thigh bone and sits like this. So now we have replaced the ball. This is the complete structure of the ball, and what we do on your socket, which is the hip joint, we put an artificial socket like this which will directly go and impact directly into the hip bone. These both can attach directly to the bone. We don't need to screw in or anything, and they help and attach to the bone in a future days. So once we have done this part, we put your hip back together like this, and this is a complete hip replacement. So we have changed the socket and we have changed the ball, and when you walk, there is a movement happening here. There is a movement happening here without any pain. That's how we solve the arthritic problem in your hip joint. So this is how we solve the hip problems, by doing a hip replacement. Now, how do we do hip replacement? Hip is a joint which is surrounded by very big thick muscles. Historically, we approached hip from back, from your buttock. That is called a posterior approach, and there is a new advanced technology nowadays which we use called direct anterior approach. What is direct anterior hip replacement? It is a technology and a type of surgery wherein we don't cut any muscle. It is a minimally invasive surgery, and it is called daycare surgery. So have you ever heard getting a hip replacement and going home on the same day? Well, that friends, technology is here wherein we can operate major surgery and send you home the same day. Well, why do we do a direct anterior hip replacement? It has many advantages. One is it is less muscle damaging, there is no blood loss, and we can get your leg length equal to the opposite side, and you can walk the same day without any problem. Historically, we have been doing a posterior approach, but that approach has more problems such as a lot of muscle damage. You might have a limp for 6 months, 1 year after the surgery, and getting your leg length is also always a difficult, and it is difficult to match your leg length. Your legs may be like this when you walk. And there is a catch here. When you do posterior approach, there is a chance of hip dislocation, which can be completely eliminated by doing a direct anterior hip replacement.
I've been suffering from avascular necrosis, AVN problem since 2 years, and that's when, because of intense pain, I wanted to meet a specialist in orthopedic. That's when my brother-in-law suggested me to meet Dr. Abhinandan sir, because a lot of doctors do hip surgery in posterior approach. Abhinandan sir is one of the only specialists in Bangalore who does the direct anterior approach, and after research I felt direct anterior approach was better because the recovery will be faster and all. So after meeting Abhinandan sir, so he clearly explained me the procedure, how many days I need to be in hospital and the recovery, everything. So I felt very kind of comfortable in discussing the issue with sir, because sir is like very down to earth and very patient in explaining all the details. So I got admitted and I got the surgery done, the direct anterior approach. After surgery, within 30 days I was able to walk normally, and within 2 months I'm back to my normal previously how I was walking previously. So it's been very kind of great experience with Abhinandan sir and Elite Orthocare. So I would like to thank Abhinandan sir, because he is one of the very few doctors who will patiently answer all the questions, and he thinks from patient perspective a lot, which kind of helped me in kind of recovering quickly.